Come in.
Hello, how are you?
Oh, I'm good again. How are you?
I'm good, thanks. My name is Quilla Hakarainen, and I'm a nurse practitioner student, and I'm going to be performing a head-to-toe examination on you. Do I have your permission?
You do.
Okay, could you tell me your first and last name?
Mike Hakarainen.
Okay, and today's date?
August 3rd, 2022.
Very good. And what are we here to do today, Mr.
A
Hakarainen?
head-to-toe assessment.
Perfect. All right. So I just want to let you know I'm going to be performing a skin assessment throughout the examination, but upon initial observation, I see that you have white skin. It looks appropriate for your ethnicity. I don't see any lumps or bumps or masses. I don't see any erythema, edema. I don't see any cyanosis or pallor. Your skin temperature is even throughout. I don't feel any excessive moisture or dryness. And then I'm also going to feel for skin turgor and mobility. It is normal. Can I see your nails? Okay. And capillary refill is under 2 seconds. Okay, very good. And again, I'll be looking at your skin throughout each body system as well. Starting off with your head, though, I see that your head is appropriately shaped. I see it is normal cephalic, achromatic. I don't see any lumps or bumps or anything like that, which is good. Feeling it. Any tenderness anywhere?
Nope.
Okay, and parting your hair. I see you've got nice, thick hair. It's evenly distributed. Again, no lesions, no lumps or bumps on your head or anything like that. Moving on to your face, I see that your face is symmetrical. Your eyebrows and your eyes are appropriately aligned with your ears. Your nose is centered. Again, I don't see any erythema or edema, no swelling anywhere, no suspicious nevi. I'm going to palpate your temporal mandibular joint. Could you open and close your mouth? Any pain?
No.
Okay, and I didn't feel any clicking, which is good. Next, I'm going to move on to some functional screening. So I'm going to start by testing cranial nerve 7, which is the facial nerve. Could you smile and frown, puff out your cheeks, furrow your brow? Okay, very good. And next I'm going to, it is intact. Next I'm going to be testing cranial nerve 12, the hypoglossal nerve. This is for tongue strength and protrusion. Could you stick your tongue straight out for me? Very good. And then in one cheek and the other, nice and strong, very good. Next I'm going to be testing cranial nerve 5, which is the trigeminal nerve, both motor and sensory. So for motor, could you clench your jaw? Okay, and I'm going to palpate your temporal and your masseter muscles. They feel very strong. And can you resist? Very good, nice and strong. Now for sensory, I'm going to be testing both your soft and your sharp sensations. So if you could close your eyes and tell me what you're feeling.
Soft.
Very good.
Sharp. Soft. Sharp. Soft. Sharp.
Okay, very good, intact. And next I'm going to be testing cranial nerve 11, the spinal accessory nerve. And I'm going to have you look towards my hand against resistance. Very good, nice and strong. Nice and strong, and shrug against my resistance. Very good, nice and strong. Okay, now we're going to be moving on to your eyes. Taking a look at your eyes, I see that your eyebrows and your eyelashes are normally distributed for the hair. I don't see any drainage. I don't see any redness. Your sclera is nice and white. Your conjunctiva, I'm just going to lower down, is clear. Your irises are blue. Your pupils look appropriately sized. I'm going to palpate your lacrimal apparatus. Any pain?
No.
Your nasal lacrimal duct? Any pain?
Nope.
Okay, and I didn't see any drainage or anything like that, which is good. Next, I'm going to move on to some functional screening. I'm going to be testing your cranial nerves 2, the optic nerve, with 2 different tests. The Snellen chart test, I'm going to test it for confrontation. So I'm going to hold my Snellen chart 14 inches from your face. Could you read for me? Very good, covering one eye. The lowest line that you can read.
LTFPH.
Okay, and the other eye?
LTFPH.
Okay, both are 20/20, very good. Next, we're going to be doing confrontation, so could you cover one eye? Okay, and tell me when you can see my finger wiggling.
No. No. No.
Okay, and the other eye?
No. No. No.
Okay, very good. Cranial nerve 2 so far is intact. Next, I'm going to be testing cranial nerves 3, 4, and 6, the oculomotor, the trochlear, and the abducens, by doing a 6 fields test. So I'm going to ask you to look at my pen light and follow it as it moves. Very good. Those nerves are so far intact. Next, I'm going to be testing again cranial nerves 2 and 3, the optic and the oculomotor. Okay, so what I'm going to do is I'm going to have you look straight at my nose, and I'm going to shine a light in your eye, and I'm looking for the constriction of your pupil constricted, and your opposite pupil constricted consensually. Very good. And this one, your pupil constricted, and your opposite pupil constricted consensually. And now if you take a look for accommodation, and I'm going to bring it in closer. Very good. I can say that your pupils are equal, they're round, and they're reactive to both light and accommodation. So next I'm going to be performing an examination with my ophthalmoscope. So at this point I would dim the light, okay, and I'm going to be taking a look at your inner eye. I see the red reflex, and I'm coming in closer, and I can easily see the optic disc, the macula, the arterioles, and the veins. You okay?
Yep.
Okay, I'm going to perform it again on the other side and compare bilateral. So I see the red reflex and coming in. Very good. I'm able to observe the optic disc and the macula. I don't see any papilledema or anything that would be out of sorts, okay?
Okay.
All right, so next I'm going to be moving on to your ears. So I'm going to take a look at your ears, inspect your ears, and palpate them. I don't see any erythema or edema. I'm feeling your tragus, your pinna, and your mastoid. Any pain?
No.
Okay, very good. And the other side. Again, I don't see any drainage, any pain when I palpate here, your mastoid muscle. Okay, very good. So now what I'm going to be doing, and I don't see any issues here. No, there's no cysts, lumps, or bumps or anything like that. So now I'm going to be moving on. What I'm going to do is I'm going to inspect the inside of your ear. Okay. And tell me if you feel any pain. So what I'm going to be doing is I'm going to lift your pinna up and back. Okay, and I can see the cone. I can visibly see your tympanic membrane. It's clear. It's non-obstructed, and the cone of light is at 7 o'clock. I'm going to take a look at your other ear. Again, lift the pinna up and back. And again, I can see your tympanic membrane. It's non-obstructed, and the cone of light is at 5 o'clock. Is there any pain?
No.
Okay, very good. So now I'm going to be performing some functional tests. So I'd like to test cranial nerve 8, which is your vestibulocochlear nerve. And what I'm going to do is I'm going to be stimulating your tragus of one ear, and I'm going to whisper 3 words with the other ear. In the other ear. Can you tell me what I'm whispering?
HQ7.
Very good. And the other ear?
19 bird.
Very good. Cranial nerve 8 is intact. Okay, so now I'm going to be performing the Weber test, and I would do this if I thought there was possibly any auditory deficit. So I'm going to strike my tuning fork, put it on your forehead, and I want you to tell me if you can hear the noise equally in both ears or better in one ear than the other.
Equally.
Okay, and now I'm going to perform the Rene test. So I'm going to strike my tuning fork, put it behind your ear on the mastoid, and tell me when you can no longer hear the noise.
Mm-hmm. No.
Can you hear it now?
Yes.
Okay, and the other ear?
No. Yes.
Okay, that tells me that your air conduction is better than your bone conduction, which is good. So now I'm going to be moving on to your nose. So I'm going to start by inspecting your nose here so I can see that your nose is centered. I don't see any lumps or bumps. I don't see any excessive redness. There's no drainage. I'm going to take a look inside of your nose. I can see that your septum is not deviated. Your nasal mucosa is moist. It's pink. Your turbinates are red. And again, I didn't see any polyps or anything like that. I'm going to palpate and percuss your frontal and your maxillary sinuses. Let me know if you feel any pain.
No pain. No pain. No pain. No pain. No pain. No pain.
Okay, very good. Now I'd like to do some functional screening. So I'd like to test your nose for patency. Could you cover one nostril and sniff in? Very good. Patent. And the other? Very good. Now I'm going to ask you to close your eyes, cover one nostril, and I'm going to put a scent in front of your nose. And could you tell me what you're smelling?
Coffee.
Very good. And the other nostril?
Hand sanitizer.
Very good. That was testing for cranial nerve 1, the olfactory nerve, and that is intact. Next, I'm going to be moving on to your mouth. I'm inspecting your mouth. I see that your lips are moist. They are pink. I don't see any drying, excessive moisture or cracking. Could you open your mouth up for me? Okay, your tongue. I see some bumps on the dorsal side. Lift your tongue up for me. It's nice. I can see the vasculature easily. I can see your hard and your soft palate. Your mucosa is moist. And your teeth are straight. Your gums. Can you open up again? I'm sorry. Yep, I can see your tonsils. They're about a 1+. Your uvula is midline. Very good. Do you have any issues with anything inside of your mouth?
No.
Okay, perfect. So now I'm going to do some functional screens. I would be testing cranial nerves 9, 10, and 12, the glossopharyngeal, the vagus, and the hypoglossal nerves. And what I'm going to ask you to do is first swallow for me, and then can you say, ah? Okay, I could see that your uvula rises with phonation, which is good. Now moving on to your neck, I'm taking a look at your neck, and I'm looking to see if I'm able to see any lumps or bumps, a goiter, or anything like that, and I don't. I can feel the skin is nice and normal. I don't feel anything like that, which is good. I'm going to feel your trachea, and I can feel it as midline. I'm going to attempt to palpate your thyroid. Could you swallow for me? Okay, non-palpable, which is normal. Very good. So next, what I'd like to do is do your lymph nodes. So I'm going to be feeling for your lymph nodes to feel if any of them are palpable. So your preauricular, your postauricular, and occipital, tonsillar, submandibular, submental, the deep cervical chain, anterior superior cervical, posterior superior cervical, your supraclavicular, your infraclavicular, and then I'd like to feel your epitrochlear nodes. Okay, and none of these are palpable, and everything feels equal bilaterally, which is good. Okay, so now I'm going to be moving on and doing an examination of your thorax. If you could turn around, please, I'd like to start with your posterior thorax.
Chair.
Yeah, that'd be perfect. Okay, so I'm going to start by inspecting your thorax, and I can see, I'm just going to have you tilt if you don't mind. I like the way the chair was tilted before, just for the camera, so I'm not right behind you. Okay, perfect. So just taking a look at the skin, I see that your skin is an even pigmentation. It is warm, no excessive moisture or dryness. I don't see any suspicious nevi or anything like that. Taking a look at your breathing is unlabored. I don't see any retractions, no shortness of breath or anything like that, which is good. So now I'm going to move on to palpating. So I'm going to be palpating your posterior thorax. I'm feeling for any crepitus, any lumps or bumps or masses, any tenderness anywhere?
Nope.
Okay, very good. And I'm going to palpate down your spine and your scapula. And again, I'm feeling for anything that would feel abnormal, lumps or bumps or crepitus or anything like that. Now I'm going to be palpating for tactile fremitus. Could you say 99?
99, 99, 99, 99, 99.
Okay, very good. Now I'm going to palpate your CVA for tenderness. So what I'm doing is I'm going to be doing a fist bump on 3 when I count. And this is over the area of your kidneys. If there's any pain or tenderness, please let me know. And that could indicate that there's a possible issue with your kidney. Okay, a fist bump on 3. 1, 2, 3. Pain or tenderness?
Nope.
Okay, fist bump on 3. 1, 2, 3. Pain or tenderness?
Nope.
Okay, very good. So next I'm going to move on to percussion. And I'm going to be, percussion. And I hear a beautiful resonant sound. I'm comparing the sound bilaterally in your lungs. Any dullness would indicate possible, fluid buildup or consolidation. Hyperresonance could mean you have COPD. I heard beautiful resonance throughout, which is good. So next I'm going to move on to auscultation. So I'd like you to take a nice deep breath in and out for me. And I'm going to be comparing the noises. Bilaterally beautiful. I'm listening for any adventitious lung sounds, such as crackles, which would be like a high-pitched, non-musical crackling noise. Wheezing, which would be a sinusoidal, musical, kind of high-pitched whistle. Or ronchi, which has a bit more of a snoring quality to it. I didn't hear anything like that. I was able to hear nice, beautiful, clear lung noises, some bronchovesicular noises up in your the top part of your lungs, and beautiful vesicular breath sounds in your exterior lobes here. So now what I'm going to be doing is, if I heard any lung sounds that were not in the right spot, or maybe I did hear some adventitious lung sounds, or upon percussion I didn't hear resonance, what I would do is test for bronchophony, egophony, and whispered pectoraloquy. So I'm going to do that right now. So for bronchophony, I'm going to ask you to say 99.
99, 99, 99, 99.
Very good. I was able to hear it, but it was more muffled. Had it been clear, that would be positive for bronchophony and alert me to a possible absent lung field consolidation, something like that. So now for egophony, I'm going to ask you to say the letter E.
E, 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 E.
Very good. I was able to hear a muffled E. Had I heard an A sound instead of the E sound, it would have alerted me to a positive for egophony, and that would have been a possible collapsed lung underneath, something going on. Next, I'm going to be doing whispered pectoraloquy. So I'd like you to whisper something. Okay, perfect. I was barely able to hear what you were saying, and if anything, it was definitely muffled. And had I been able to hear you loud and clear when you were whispering by listening through your lungs, that would have been positive for whispered pectoraloquy, and again, alerted to me to a collapsed lung, consolidation, something like that. I didn't hear anything like that. Very good. If you could turn around for me, I'm now going to inspect your anterior lungs at thorax. So again, taking a look at the skin, I don't see any issues with your skin. No edema, no erythema. I don't see any lumps or bumps or anything like that, which is very good. The hair distribution is normal for a healthy adult male. So now I'm going to palpate your lung, your thorax, anterior thorax, feeling for any lumps or bumps or crepitus. I don't feel anything like that. Any tenderness anywhere?
No.
Okay, very good. And now I'm going to assess. Can you take a deep breath in for me? Very good. And then out. Good. My hands move symmetrically, so that is very good. Again, I don't see any retractions. I don't see any heavy breathing, no shortness of breath or anything like that. Everything looks symmetrical. Now I'm going to move on to palpating for tactile fremitus. So could you say 99?
99, 99, 99, 99, 99.
Very good. And now I'm going to be percussing your anterior thorax. And again, I'm listening for resonance. And I'm comparing bilaterally. I can hear nice resonant sounds. Again, dullness could indicate some like a pneumonia, a consolidation of sorts, and hyperresonance would be seen maybe someone who has COPD, and I didn't see any of that or hear any of that. Next, I'm going to auscultate, and again, I'm listening for any adventitious lung sounds. Deep breaths in and out. Or if there's any diminished sounds, I can hear nice, clear lung sounds. No adventitious lung sounds, very good. Okay, so next I'm going to be moving on to cardiac exam for you. Okay, so what I'd like to do is actually have you lay down. So I'm just going to move the chair so that you can kind of perfect. All right, so are you comfortable?
Yep.
Okay. So what I'm going to first do is be inspecting your extremities. So I'm looking at your extremities. I'm looking to see the color. I don't see any pallor, cyanosis, no erythema. I don't see any edema, any swelling, no excessive vasculature or anything like that, which is good. And I'm palpating them. And again, I don't feel any swelling or edema, erythema, anything like that. Okay. And I'm also going to take a look at your precordium. This is the area that's overlying your heart. And I'm taking a look to see if I see any pulsations, any heaves, any thrills that would alert me to some turbulent blood flow beneath. I don't see anything like that. I'm looking at the point of maximal impulse, which is at the 5th intercostal space in the midclavicular line on the left side. I don't see anything that would alert me to that. I don't see any pulsing or anything like that, which is normal. Now I'm going to inspect your jugular vein. So I'm taking a look at both your right and your left jugular veins. And what I'm going to do is now focus on the right side. And I'd like to estimate jugular venous pressure. So what I'm going to do is I'm going to find the point of highest pulsation on your jugular vein, and I'm going to take this horizontally from that point, and then at the sternal angle, measure, and I'm getting 1 centimeter. I would add 5 to that, and that's your estimated jugular venous pressure, which would be 6, and that is normal. It wouldn't indicate to me to look for possible heart failure or anything like that. Next, I'd like to palpate your pulses. So I'm going to start with your carotid pulses, and I'm going to be comparing bilaterally. 2 plus, 2 plus, and now your brachial. 2 plus, equal bilaterally, your radial and your ulnar. 2 plus, equal bilaterally. 2 plus, equal bilaterally, your femoral. 2 plus, equal bilaterally, your popliteal. 2 plus, 2 plus, your posterior tibialis. 2 plus, equal bilaterally, and your dorsalis pubis. 2 plus, equal bilaterally. Very good. Now I'm going to palpate for calf tenderness. Deep palpation. Do you feel any pain or tenderness?
No.
Okay. And on the other side, any pain or tenderness?
No.
Okay, very good. Next, I'd like to auscultate for carotid bruit. So I'm going to use the bell of my stethoscope. So if I heard a bruit, that would indicate turbulent blood flow, which would be a partial or a possible partial occlusion. I'm going to ask you to hold your breath in. No bruit present. And the other side, again, hold your breath. No bruit present. Very good. Okay. So next, I'm going to palpate your precordium. So what I do is I'm feeling over where the heart is, and I'm feeling for any heaves or thrills, any pulsations. I don't feel anything that would alert me to a possible murmur beneath or turbulent blood flow. Next, I'd like to palpate for the point of maximal impulse. This is again at the 5th intercostal space, mid-clavicular line on the left side. I'm able to feel a very brisk, light tapping, which is normal. Okay, so next what I'm going to do is I'm going to move on to auscultation. And what I'm going to be doing is I'm going to be listening to your heart in 5 different places, starting with the diaphragm of my stethoscope. So I'm listening to the aortic area, which is in the 2nd intercostal space, right sternal border. Pulmonic, the 2nd intercostal space, left sternal border. Erb's point, 3rd intercostal space, left sternal border. Tricuspid, 4th intercostal space, left sternal border. And the mitral, which is the 5th intercostal space, mid-clavicular line. Very good. I'm able to hear beautiful love dub S1 and S2 sounds. I didn't hear any extra heart sounds, murmurs, gallops, or anything like that. Now I'd like to perform the mitral maneuver. Could I have you lay on your left side? And I'm again going to listen in the mitral area with the diaphragm of my stethoscope. The reason I am doing this is your heart is now closer to my stethoscope. I could pick up better. Okay, and now I'm going to flip to the bell of my stethoscope and listen again in the mitral area. This will allow me, you can lie back on your back. Doing so allows me to pick up on some like deeper, lower tone sounds. Now I'm going to listen again with the bell of my stethoscope, starting in the mitral area, the 5th intercostal space, mid-clavicular line, left side. The tricuspid, the 4th intercostal space, left sternal border. Erb's point, 3rd intercostal space, left sternal border. Pulmonic, 2nd intercostal space, left sternal border. And the aortic, 2nd intercostal space, right sternal border. Perfect. I wasn't able to hear any S3 or S4 sounds, any murmurs or anything like that. I'd like for you to sit up now for me, please, if you would. Just briefly, and I'm going to have you bend over exactly like you're doing. No, you can just stay right there. And I'm listening for aortic regurgitation. Are you bending forward? Yeah. Okay. Very good. Not heard. Beautiful. Next, what I'd like to do is I'm going to perform an exam on your axillary. And what I'm going to be doing is I'm going to be feeling deep into your axilla for the central lymph, your anterior axillary line for the pectoral lymph, your posterior axillary line for the subscapular lymph, your lateral lymph here on the lateral aspect of your arm, and the epitrochlear. Very good. And then more palpable. And again on this arm, high up for the central, the pectoral, subscapular, the lateral aspect of your arm for the lateral, and your epitrochlear. Okay, very good. None are palpable, which is normal. So next I'm going to be performing an abdominal assessment. So if you wouldn't mind laying back down, if you are comfortable with that. Okay, and if you could put your arms by your side, that will allow your abdomen to be soft, nice and soft from here. Are you comfortable like
Yes.
that? Okay, good. So I'm going to start by inspecting. I'm taking a look at your abdomen. I'm looking for any pulsations, any signs of hernia. The skin is good. I don't see any erythema, edema, no signs of hernia. Your umbilicus is midline. It is inverted. The hair distribution is normal. Again, there's nothing that I can see, no masses or anything like that. So now what I'm going to do is I'm going to start with auscultation. So what I'm going to do is I'm going to be listening in your abdomen for vowel sounds. I'm going to start in your right lower quadrant. And your right upper quadrant. Left upper quadrant. And left lower quadrant. Very good. Your vowel sounds are normal active, about 0 to 5 seconds apart. Normal active, which is good, and they're present in all 4 quadrants. Next, I'm going to be listening over your liver for any possible friction rubs. None present. And splenic area for any possible friction rubs. Not present. Next, I'm going to be listening to your arteries. I'm going to be listening to the aortic for any bruit. No bruit present. The renal arteries. No bruit present and equal bilaterally. The iliac. No bruit present, equal bilaterally. And then the femoral. No bruit present and equal bilaterally. Had I heard a bruit again, that would have been possible turbulent blood flow and alerted me to a possible partial occlusion. I didn't hear any of that, which is good. So next what I'm going to do is I'm going to move on to percussion. So what I'm going to be doing is percussing your abdomen. And typically you hear tympany throughout, which I do. Tympany throughout. Very good. Next I'm going to attempt to palpate the lower and the upper borders of your liver to measure them. So I'm going to start low in your abdomen by the umbilicus. And I hear tympany. 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 Okay, right here I heard dullness, so I'm going to mark this as the lower liver. And then I'm going to go high up in your chest, and before we heard resonance, and I hear resonance, 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 resonance. And right about here I heard dullness, so I'm going to measure. Okay, and 7 centimeters, which is a normal size. Very good. Now I'm going to attempt to palpate your spleen. And so or percuss, excuse me. So I hear tympany. Tympany. Now I'm going to ask you to take a deep breath in and hold. Okay, and I could still hear tympany. You can relax. Had I heard dullness, that could have alerted me to a possible splenomegaly, like an enlarged spleen, but I didn't hear any of that. Very good. So next what I'm going to do is I'm going to do some light palpation, okay? So I'm going to lightly palpate your abdomen. Tell me if you feel any pain or tenderness.
No.
Okay. I'm feeling for any lumps or bumps or masses. Your abdomen is nice and soft. You don't feel any tender spots?
Nope.
Okay, good. Now what I'm going to do is deep palpation. Again, tell me if there's any pain. Any pain? Okay, I'm feeling for any masses, any kind of like lumps, if there's any impacted stool or anything like that. And I'm wanting to see if you feel any pain in any areas.
No.
No pain?
Nope.
Okay, good. Now I'm going to attempt to palpate your liver. So I'm going to do the hooking technique. Take a deep breath in. Okay. Not really that helpful, but I don't believe it's enlarged, so that's normal. And then your spleen. So I'm going to do deep palpation here as well. Deep breath in, hold your breath, and release. Okay, and I'm unable to palpate that, which again is normal. I don't have any belief that it's enlarged. Next, I'm going to attempt to palpate your kidneys. So I'm going to put my hand under your flank here. All right, deep breath in. Okay, not really palpable, which is okay. And then the other side. Again, deep breath in. Okay, very good. All right. And now what I'd like to do is palpate your the lymph nodes, your inguinal nodes, both the horizontal and the vertical. And I'm feeling for any enlarged lymph nodes or any palpable lymph nodes, and they're not palpable, which is good. Okay. So now what I would like to do is some special techniques, okay? And so what I'd like to start with is what I'm going to be doing is testing to see if there's any possible inflammation in your abdomen. So I'm going to start with rebound tenderness. I'm going to press down on your abdomen and release quickly. Any pain or tenderness?
No.
Pain or tenderness?
Nope.
Okay. If you did have any pain or tenderness, that would have alerted me to a possible peritonitis or appendicitis. Next, I'd like to perform the psoas sign. So what I'm going to do is I'm going to lift your leg, stretching the psoas muscle. Any pain or tenderness?
Nope.
Okay, and then could you roll onto your side?
Which side?
Just your left side is fine. Okay, and again, I'm going to stretch the psoas muscle. Pain or tenderness?
Nope.
Okay, very good. You can go back onto your back. Had you felt any pain or tenderness in your right lower quadrant, but from the psoas muscle stretching, that could have alerted me to a possible appendicitis. Next, I'm going to perform the obturator sign. So I'm going to lift your leg and internally rotate your hip. Any pain or tenderness?
Nope.
Okay, that is stretching the obturator muscle. And had you had any pain or tenderness in your right lower quadrant, that could have also alerted me to a possible appendicitis. Okay, so next I'm going to be performing rebound tenderness. So, or not rebound, the Ravsing sign. This is, it is a rebound, but what I'm going to be doing is pushing down deeply and gently on your left lower quadrant. Any pain or tenderness?
No.
Okay. Had you felt pain or tenderness in the right lower quadrant, that would have been positive for Ravsing and alerted me to a possible appendicitis. Next, I'm going to be performing the Murphy sign. And this is looking for a cholecystitis. So what I'm going to be doing is I'm going to be palpating deeply but softly over where your gallbladder is, okay? And so then I'm going to ask you to take a deep breath in. Okay, so we're going to do this now. Deep breath in. Any pain or tenderness?
No.
Okay, a positive Murphy sign would be pain or tenderness elicited when the gallbladder is kind of pushed towards my hands, and that would have elicited, or that would have alerted me to a possible cholecystitis. None of these are present at this time. And so what I'm going to have us do is actually move on to the musculoskeletal exam. So I'm going to have you sit up. Okay, and then we're going to get rid of 2 of these chairs. So what I'd like you to do is start by just walking up and down the hallway for me quickly, if you wouldn't mind. And what I'm doing is I'm assessing your gait. You have a nice, even, steady gait, I see. Very good. You have coordinated movements, and you can come on back. Very good. Nice coordinated movements. Perfect. And I'm going to have you stand right there. Next, what I'm going to be doing is inspecting and palpating all of your joints, okay? So I'm going to start by looking here at your neck joint, and I'm going to palpate around your neck area. Any pain or tenderness? Okay, I'm moving on to your shoulders. I'm palpating for any pain, tenderness, lumps, or bumps, any possible bursitis in the shoulders. Okay, and then your elbows. Olecranon process, the medial and lateral epicondyles, olecranon process. Any pain or tenderness, let me know. Again, I'm feeling for any lumps or bumps or crepitus, anything like that. Your wrist. I'm palpating each joint, feeling the joint, and in your hands, the metacarpophalangeal, the proximal interphalangeal, and the distal interphalangeal joints. Again, for any nodules, any lumps or bumps, and I'm comparing all of these bilaterally. And I can say that your shoulders, your elbows, your wrists, and then the joints in your fingers and hands all felt equal bilaterally. Next, I'm going to move on to the hips. And again, I'm looking to see if they look symmetrical, and I'm palpating them. So yeah, crest and the where your femur is. Again, any pain or tenderness?
No.
Okay, and I didn't feel any lumps or bumps. And then your knees. Taking a look at your knees, I don't see any swelling. I don't see any erythema. They look equal bilaterally. And I'm going to palpate your patella and the medial and lateral aspects. And I don't feel any bumps or lumps or anything like that. And your ankles, your medial and your lateral malleolus, they feel equal bilaterally. And then the joints in your feet and your toes. Again, no lumps, no bumps. Everything looks equal bilaterally on you. I don't see any swelling or erythema, edema, or anything like that in any of your joints, which is good. So next what I'm going to be doing is performing, or actually your spine. Can't forget your spine. Okay, I'm going to palpate it. Again, I'm feeling for any lumps or bumps or tenderness, nothing like that. So now what I'm going to do is range of motion for your spine. You can just face forward. I'm going to ask you to bend, flex your body forward, touch your toes. Beautiful. Extend your back backwards. You're very flexible. Very good. Can you do a lateral bend of your spine? And laterally bend the other way. And can you rotate? And the other way. Any pain or tenderness with any of that?
No.
Very good. Next, I'm going to be performing a range of motion for one upper extremity joint and one lower extremity joint. So if you can take a step forward, we're going to be doing the shoulder. So I would like you to flex them forward, all the way up if you can, and extend them back. Okay, and abduct away from your body, and adduct to your body. And then I would like you to externally rotate them and internally rotate them. Very good. Any pain or tenderness with any of that?
No.
Okay, very good. And then for your lower body, I'm going to do your hips. So I would like you to, and if you need to hold on, you can, flex at your hip forward and extend your hip back. Sorry. Extend your hip back. Very good. And abduct your hip. Adduct your hip. Externally rotate it. Internally rotate it. Very good. And can you repeat it on the other side? I want you to flex and extend and abduct, adduct, internally rotate,